I'm Dr. David Hill, and today we're going to be talking about causes of nightmare leg pain in children. Now, I want to sort of divide this term up and sort of put it into medical terms that make more sense to me. So what we're really talking about here, I think, is leg pain that seems to wake children up at night. Now, they may also be dreaming, they may also have nightmares or bad dreams at that time of night, but really we want to tease those two things out because nightmares don't really cause leg pain, and leg pain doesn't really cause nightmares. That said, there are some forms of leg pain that wake children up in the middle of the night. Now, the most common thing we think of is called growing pains. Notice the air quotes. Why would I put air quotes around growing pains? Well, because growth doesn't really cause the pain. It's a misnomer. Kids are growing and they do get leg pains in the middle of the night, but it turns out that these don't really occur any more commonly during periods of rapid growth than they do at other times. They just occur during childhood. Usually in younger childhood or school years, the pain tends to be in both legs. Usually it's felt in the long bones of the legs, like deep, deep, deep in the thighs. It may indeed wake the child up at night. They may need to be massaged or get some sort of warm compress or even a soak in a warm tub to feel better. You can certainly try Tylenol or ibuprofen to try and make the pain better. It may come and go over months. Now, there are some things about nighttime leg pain that would bother me. I don't like to hear that it's always in the same leg. I like to hear it going back and forth, maybe in two different legs or up and down, maybe sometimes in the lower leg, sometimes in the upper leg. I don't like it to be really severe. The child may cry or be uncomfortable, but it shouldn't be incapacitating. I never expect this type of pain to cause limping or difficulty walking. Leg pain that alters the gait, that really causes pain with walking, probably can't be written off as just growing pains. That needs to be looked at further. Certainly if there's joint swelling, if there's fever involved, we have a whole different list of things that can be bone infections, joint infections, juvenile rheumatoid arthritis, even cancer of the bone or the cartilage in the legs. Those things are really serious and need to be evaluated. But if your child is having cramps or deep leg pain in both legs that may wake them up at night, gets better with a little massage, heat, reassurance, or Tylenol, comes and goes over time, we can feel pretty reassured that those are, in all likelihood, growing pains. So remember, if something seems funky, if you're not sure about it, always talk to your child's doctor and get somebody's opinion on what it might be. Talking about nightmare leg pains, I'm Dr. David Hill.